this session, so we'll have that video posted to our website in the next day or so. Our website can be found at thriveed.org. And finally, I want to introduce our panelists who are going to kind of guide our conversation and answer your questions. First, we have Vicki Pratt, President of Thrive Economic Development, Kevin Kaufman, Director of the Wisconsin Small Business Development Center at UW-Whitewater, and Gail Scott, Director and Health Officer for the Jefferson County Health Department. So thank you again for joining us, and I'm going to turn it over to Vicki to get us started.
Yeah, so thank you. Thanks, Julie, for putting it together, and thank you for registering. So Kevin and I from the SBDC launched a program back on the 1st of April called Back to Business to really help our businesses across the two-county region understand the resources that were available to them, help some of them with some real hands-on work to either apply for EIDL or the PPP loans, and to also start thinking about how can I look at my business differently? How can I think about doing business differently? Recognizing, of course, that especially for a lot of you folks on the call on the professional services side of the house, it's hard to do somebody's hair virtually. It's hard to give a massage virtually. I mean, these are things that really can't be done. But I have seen some folks offering services that are alternatives to that, but complementary to what they do for a living during this time of closure. So what we really wanted to talk about today is the guidelines for your industry sector, right? And I'm sure most of you have seen those guidelines. If you haven't, we have the guidelines on our website. We have links to WEDC as well for the guidelines. Just as a reminder, WEDC has posted guidelines for reopening for 16 different industry sectors. So you can look yourself up there and figure out where you fit. But I wanted to throw out a bunch of questions that we can talk through today, and I want to hear from you. Have you reviewed the guidelines? Do you intend to implement the guidelines? All of them, some of them, under what circumstances? And again, nobody's holding your feet to the fire for any of this. I'm just wondering how you're looking at your business and the guidelines and trying to figure out what will work for you and what won't work for you. How do you think this is going to affect your business, short term and longer term? I'm wondering if any of you are promoting your business as kind of guideline compliant. Are you doing any marketing or promotion around that? And I want to hear from you what you've learned about your business throughout this process, because I think that's something that everyone wants to share with one another. I mean, Kevin and I have spent a lot of time talking to businesses in the last month or so, and it's interesting. Many businesses are learning the same lesson, but they're not really talking to their colleagues about what they're learning. And I think this is a great opportunity to share some of that. So let me just start by throwing some of that out. Have you reviewed the guidelines? What do you think of the guidelines? How do you think you're going to use the guidelines? And remember, they're guidelines. They're not law. They're guidelines. So I'd love to hear from you folks on the call.
Yeah, you can please just feel free to unmute yourself depending on.
Y'all know how to do that? Little microphone down in the corner.
Anybody?
No one wants to be the first ever.
Yeah. So I'm sure everybody's seen kind of the world famous picture. I forget if it was Netherlands or where it was, but somebody sticking their hand through the mail slot and having their nails worked on by somebody sitting on a chair outside the house. Kind of a nice innovative thought, at least. Not sure, and I always kind of hark back. I had lived up in the Twin Cities, and the St. Paul Saints used to have a barber chair that was down the third base line, and you could get a haircut while you were watching the ball game. And
there you go.
Yeah, and so we're so tell me how you guys have weathered the storm. and what your thoughts are around reopening and how to do it. I can tell you as one person's opinion, there's a huge pent-up demand, and I suspect that your businesses will be coming back with a roar. I want to clean this up as best I can, but somebody had sent me a graphic of let's call it a lady of the evening leaning over and saying $50 for almost anything, and the person in the car saying, "Do you cut hair?" So
$50, it's a deal.
right, exactly. So what's happening in your worlds? What are your thoughts around the guidelines?
So I can go. So I have a residential cleaning business, and I did review the guidelines. And I asked my clients that once we come back, which we're starting back this week, that they have their doors and windows open if they can for good ventilation. Their furnace be turned off, and they either not be home while we're cleaning, or they're in a room that we're not going to clean with the door closed. I usually have a team of 3 to 4 people going into each home, so we're there a short period of time, typically 45 minutes to an hour. So, and they have, as of, this is just our second day back, but they have complied. And we also always wear shoe covers and gloves while cleaning. We have added masks to our cleaning regimen, along with a disinfectant, because I'm a green cleaner. So the disinfectant we are now using is called Shaklee Basic G, which does kill the coronavirus. So those are the changes that I have made.
Has Shaklee certified that that particular cleaner kills COVID-19? Okay.
They have, and I went on the CDC website and registered the number, and it passed. Perfect. So, and I believe on the container it does say the coronavirus. It doesn't say which strain. I don't know. I'd have to review it. It could say COVID-19. I doubt that it does, but it does say coronavirus, and I know there are different strains of coronavirus.
Yep.
So.
Interesting. Well, thank you for sharing that.
Sure.
Was your crew willing to come back?
They were. We have been off for 2.5 months. I did receive the PPP payroll protection loan, which was wonderful. We had a staff meeting last week, Wednesday, and discussed everything, and everyone was on board with the changes that we've made. I don't have anyone that is afraid to go into homes for cleaning. Most of our clients are elderly, and they've stayed home. And as long as they're okay with us coming in, it's worked pretty well. So they don't have any fears. We do take temperatures in the morning before we start the day to make sure everyone is well.
Nice.
Yeah. Well
That's
done.
Nice. Yeah, very well done. Anyone else want to pipe up? Well, I'm curious since, oh, I'm sorry. Did someone want to say something?
Yep, Denise.
Sure. Yes, I have a home cleaning business as well. Hi, Diane.
Hi, Denise.
But I am my only employee. It's just me. And so I've been off since mid-March, and I just am not sure when I should go back. I work pretty much full-time, and since it's only me, I'm in the homes, 4 to 8 hours a day.
Hmm. Are you buying any protective equipment? I mean, do you think as you go back, you have to maybe change some of the things, like wear a mask? Did you wear a mask before?
I didn't, no.
Okay. Are you thinking about that?
I think about it, and I think that would be really hot to wear that all day long. So I give credit to the people that have to.
Mm-hmm. Mhm. Well,
I
thank
don't
you. Thank
know.
you for sharing. Oh, I'm sorry. Go ahead.
Yeah, I don't know if there are any guidelines to say when it's okay to go back, or if we just go back as we think.
Yeah, and the guidelines, and Gail's on the call, but the guidelines are basically, once the Supreme Court ruled last Thursday, every business is free to open up when it wants to. The issue becomes, and when I say the issue, again, these are guidelines and not mandates. So there are guidelines that have been put out there for different businesses in terms of how to get back to work, how to do what they do. And, it's certainly up to each and every one of you to take a look at those guidelines and figure out what's going to work for you and what's not going to work for you. And there are risks involved. I mean, as you just said, Denise, it's just you, as opposed to Diane has also got other employees to worry about. So we talk about safety guidelines from the perspective of your employees, your customers, and then if you actually have a facility like a salon that people come to, then you also have to look at the safety of the facility over time, right? So there's some ventilation stuff and some cleaning stuff that is embedded in the guidelines for every industry sector. But it's really about your comfort in terms of you, your employees, and your customers based on the guidelines.
This is
So-
Gail Scott. I think that Diane has a really good handle on operating safely, and I commend her for that. It looks like you looked at all the aspects of good social distancing, infection control, taking temps of your staff, looking at not having your clients nearby, so you're definitely keeping apart from them, cleaning with a product that kills the coronavirus. So opening the windows, that's a great example of how you're looking at air exchanges. And then looking at your clientele. And I think a couple other things I would think about, and I know you talked about taking temperatures, but also asking staff to limit, and I know you can't force them, but maybe think about their social distancing outside of work to protect themselves as much as possible. And if they look at it as they're trying to protect themselves and their family, and then also be able to work. So I think that you're doing, have some great examples. One of the things that we've been talking about in public health is if people are interacting at work or going into homes or have customers, this sounds like a very tedious thing to do, but it may be a good thing to do right from the start. And that is to have a log of people that are either coming into your business, or for Diane, like homes where your employees are going into. So keep a log of each employee and what home they were in. And that way, if we get a positive case, you would have that log, and it would be very easy to track where people were. I know I don't hardly remember anymore. Well, I do now because I don't go anywhere except inside my house or walk on my driveway. So I do remember where I've been, but once I'm out and about, just to remind ourselves who we have interacted with and where we have been. And on the public health side, we want to keep a close eye and are going to be designing more ways of looking at our data and where our cases are. We do know where they are, but to map that out, have a visual. Right now we have 54 cases, which isn't too many to just sort on the Excel spreadsheet and figure out where our cases are, which they are pretty much scattered throughout Jefferson County. And I didn't look at it like in the last few days, but when I last looked at the age data, it's our working people, and that makes sense. They're out working. There's healthcare providers. People are out and about working, and of course, that's where you're going to pick it up. The age group again is mostly under 60, but and then the hospitalizations are like 30-ish, 20-ish and above. And of course, the people that are most likely to die are the elderly or the people with other health conditions. So those are all things to consider. We are getting to the point where we can pretty much test anybody who wants to test. We aren't encouraging like full out everybody get a test yet, because that test is only good for that day. It's a crazy thing where we've had a person test on a Monday, and on Wednesday they developed symptoms, and they were tested again and they were positive after being negative on a Monday. But we certainly right now can absolutely test everybody with symptoms. I can issue an order if it's an essential worker to get tested if they've been in contact with a positive case. So for instance, I'm just throwing this out as an example. If a police officer came in contact with a positive case, we are able to get that officer tested right away. And depending on the risk and the need to get the police officer back on the job, we can run that through rapidly. And then we were talking today on a call because we were saying, well, should we really test them immediately? Because the incubation period is about 2 to 14 days with an average time frame when you get sick of about 5 days. So we may back up that recommendation a little bit to wait to make sure that it is a true negative.
Hey, Gail?
Yes, ma'am.
If one of our businesses is concerned that they've got an employee that has been exposed, or they're concerned that they've been exposed, how do they get to you to make sure that they can get that testing done? What is the avenue?
Well, if they've been exposed, we have a group of nurses and other trained staff who will contact them if we know they've had an exposure to a positive case.
If they think they've been exposed.
If they think they've been exposed, they can certainly either work through public health, or they can, in Fort Atkinson, we have a wonderful drive-through testing at Fort Healthcare, and they can call the nurse triage line. I just call the general hospital number, the 568-5000, and I just ask for the COVID testing, and they'll switch you to that line, and you can discuss what your concerns are. And a lot of times they just give us a call or an email. And if people are still worrying, they can certainly contact public health. And the best way to contact us is through email, because we are basically, all of our nurses except 2 are working at home. And so we have an email. It's just COVID, COVID 19 at Jefferson County WI, and then a dot, only one dot, and then gov, G-O-V. And so that's
great.
way, or you can call the 920-674-7275, and our office people will get you in touch with us. Again, it's really almost better to do email, because personally, I'm in one of these meetings or on the phone all the time. So I can a lot of times email you while I'm in another meeting. I'm not doing that now, but so
Appreciate that, Gail. Appreciate that. Thank you.
no, I'm totally concentrating on you, Vicki, and your meeting. You're very important.
Thank you. So I also want to throw out to this group, have you had to go out and purchase some PPE supplies? And, you know, have you been able to find what you need? Have you taken a look at your pricing structure and said, gee, if I have to add those costs in, maybe I have to change my pricing structure? How is that affecting any of you with your businesses right now? Nobody. You got to unmute, Diane.
Okay, so I did, when I saw this kind of coming, I did reach out to my Shackley rep and talked about the Basic G and ordered it. And she actually had a bottle of it at her home and then ordered some for me, which was on back order. So I did receive it recently along with the spray bottles that you should use when you're using the Basic G. I had a client who gave me 40 homemade masks, which were wonderful.
Nice.
They have the little piece of metal in the nose piece, and they're breathable. So Denise, if you're wanting a mask, I've got some. I'm happy to share them with you because I do have some extras. So those are the things, really the only things I had to buy, because we typically wear shoe covers, we wear gloves. If someone is in need of gloves, I have a brother who supplies them. So if there's someone out there who needs them, I would contact him and get them for you. If that's what you're looking for, if that's what you need. So really those are the only things that I've had to do, along with anytime I can get hand sanitizer for my vehicles. The other thing we're doing is before we leave homes, everyone takes their gloves off, washes their hands in one said sink, and then we clean the sink, and then we sanitize our hands before we get into the vehicle, and once we get in, we sanitize again. So I have been able to find hand sanitizer, which I think is really important with traveling as a team from home to home.
Yeah, it is. Those are wonderful precautions that you're taking. Good for you. Someone else piping up here?
Important.
Yeah, it is important. It is important. Are you promoting to your customers that you are that you've adopted some new guidelines? I mean, is that part of your marketing?
Mm-hmm. We typically clean about, I don't know, maybe 60 homes a week. And I have called every single client to make sure they're okay with us coming in, number one. And I do let them know the different protocols and that we are taking, which they are really happy that we have gone that extra step in order to be safer. So, but it takes time. It takes time to call everyone and explain everything. And if they have questions and, you know, they have to decide if they're ready to have us come in. So those are all big steps.
Good for you. So has anybody said, no, I'm not ready yet?
I have had 2 this past week, just because they're elderly and they have underlying health issues and they'd like to wait another 2 weeks to see how things are going. So otherwise, everyone is excited that we're back.
I'll be excited when my cleaning service comes back. They are not back yet. Yes, it's amazing how dependent you become on on these different services, and when they're not available to you, you really understand the value. So that's great news. So is anyone else out there kind of promoting that your business is guideline compliant? Do you think that that's important for your business to promote that?
So I'm in the event production business. We do events all over the state of Wisconsin. And we've noticed that when it comes to guidelines, there just aren't any for events. Not that I think we should be rushing back into events anyways. But when it comes to compliance, it still seems to be, the general recommendation is 10 people or less. Ironically, the evening that Wisconsin opened, we started getting calls right away for people who were ready to go back to events. And as a company, that forced us to make a statement that basically said, hey, everybody, we're going to wait until June 1st before we start assessing events. Each event will be on a case-by-case basis. And we expect that you as an event organizer have a COVID preparedness plan and that your venue has a COVID preparedness plan. So how many people are you going to allow in? How far apart do they have to stay? What's your max capacity? What do we have as far as contracts go that allow us to bow out? We put a lot of stuff in place. And then we also implemented a COVID fee, which I know some of our clients came back to us and they weren't happy, but the reality is, with so much information flying around right now, we had to look at it as what's the most factual information we have and what does that mean? So in the case of for us, for events, we look at it as every microphone that goes out, every cable that goes out, every case that goes out, anything that goes out of our warehouse has to come back and then be disinfected. So for us, that also meant, okay, who's going to draw the short straw and have to start doing the cleaning and all that kind of stuff. So the cost of business actually has gone up with COVID if we're trying to be, if we try to adhere to guidelines. That's not to say that there aren't companies out there, but that aren't willing to adhere to those, but we're not one of those companies. So that's been interesting. By and large, though, everybody who's seeing the COVID fee has appreciated it, and we're actually seeing some business return because of that. So not pushing guidelines, but we are pushing, COVID preparedness and extra fees because there's a real fee to maintaining equipment in this new normal.
So Chris, are you up to speed on what a good COVID plan looks like? And is that I'm picturing somebody coming to you and you say, I'd like to see your COVID preparedness plan. And they say, well, what's that? Do you refer that on, or is that something that you can provide as an added benefit to working with you?
That's something that we're providing as an added benefit. Primarily, it's becoming part of our vetting process. So if you come to us and say, well, I don't have a COVID preparedness plan and I'm not going to have a COVID preparedness plan,
then we're done.
We're not going to do business with you. And that's the unfortunate reality. But again, the health and safety of our staff and of any attendees at events is more important to us than,
And you're seeing people appreciate that and seek you out because you're doing things right.
Yes. So for what it's worth for other businesses as well, it may not be a bad thing to say, hey, this is our preparedness plan, even if it's just saying we're going to have, extra fees or anything along those lines, detailing your cleaning processes. I think it helped gain back some trust and some confidence as events move forward, which again, I'm not sure that as a state we're ready for events to move forward, but some people are charging straight ahead.
Yes, they are, Chris. If you go to the WEDC guidelines for reopening, there is a a guideline for businesses that are in the entertainment and amusement industry sector. There's another one that is specific to hospitality and lodging. There's another one that's specific to outdoor gatherings. My point is, I think there's important pieces of information in each one of those that I'm sure, Chris, you would be using when you're talking to those venues about their COVID preparedness plan, right? Because I mean, I believe a lot of the stuff would be transferable in those types of venues.
Yeah, we definitely have gone over the plans, and a lot of places, a lot of venues are implementing it just by the nature of wanting to have people back and knowing what they have to do. So for the most part, we're not seeing too much pushback. But in some cases, the plans just feel like they're perhaps not strong enough.
I actually visited with a business last week that is, how shall I put this, in the supply chain for funerals. Aren't we all? But in his particular instance, he makes a product. And of course, since the pandemic, funerals, by and large, have ceased to exist because of the concern about gathering, because of the concerns about social distancing, and what have you. And thinking about that particular industry sector, we had a very long conversation last week around this and around how businesses in that, and again, this is professional services, businesses in that industry sector are going to be able to move forward and still support the social distancing guidelines, still do all the things that need to be done. And yet, we've all been to funerals. This is a very difficult time, and people want to be near other people when you are grieving together. So this was really tough. This was one of those where you come away from it and you're struck by how hard this really is in some industry sectors, and particularly in that one, right? So talk about lessons learned. Wow. Right? Big lessons learned. So thanks, Chris, for sharing that. How do you think, do you think that given your particular business, that this is something you're just going to continue to do? I mean, is this going to probably be an ongoing part of maybe just safe practices for people to have events? So it may not be COVID-19 going forward, but it might be, safe practices to promote healthy environments. I mean, do you see that playing itself out?
I think that some of it will become best practice, specifically when we look at like equipment rentals. But as far as implementing it, yes, we're getting requests for events, but I don't truly see an event-based industry making a rebound in the next 18 months. So I think by the time our industry makes it back to close to pre-COVID, this will have just become the new normal. Everybody will just be doing this by default versus making it a sales point.
That's a heck of a prediction, and I don't think you're wrong. I don't think you're wrong, but it's a hard message to hear, and yet I do think that we will have, everyone keeps talking about the new normal, whatever that looks like, and I think you just hit on it. I think you just hit on a really good example of what the new normal will be. Just like Denise or Diane in your business, you're going to, and Denise as well, you're going to probably be promoting that we take these extra steps because we're coming into your home. Interesting stuff. So I'm wondering about liability. Have you folks talked to your insurers? Do you think that, and I have no idea what type of liability insurance you currently carry, but as you're going into people's homes or as you are getting back into business and putting equipment out there for events, things like that, even though you're taking all the right steps to ensure that it is as safe as possible, have you talked to your insurers about your own business liability and how that might be affected should somebody, say that, well, as a result of X, I think I, was exposed to something? Anybody had those conversations? No?
Vicki, I'll just say I was on a call this morning for about reopening restaurants, and that question came up, and the speaker just said, like, it had obviously been a question that he's been asked so many times, and it's one of the first questions he gets asked, but outside of without any case law to really go by, it's a popular question, but it's unfortunately a question that there just doesn't seem to be like a concrete answer to, but it's one that, so many people are asking. So I know we're scrambling to try to figure out an answer for it or guidance at least.
Unfortunately, I think what's going to happen is there's going to be some test cases that will figure out under what circumstances can X happen. But the reason I put that out there, I too have been on calls, in particular with some larger accounting and legal firms who have been having these conversations with their clients. And I've been on some of those webinars where they're, talking about take a good look at your policy, review your policy, make sure you're adhering to best practice guidelines for operating safely. Make sure that you've had that conversation. If you've got an attorney that you can chat with as well, that isn't going to cost you a fortune to chat with. I mean, you might want to run it past him or her. But it's always a good idea to have that conversation with whoever you have your business insurance through to make sure that your insurer understands that you are absolutely operating according to the CDC best practices for how to conduct business in your industry sector. Because if and when the cases do start happening, and it's probably only a matter of time before there are some test cases out there. I think those who have kind of checked that box, had that conversation, are probably going to be feeling a lot more confident should they find themselves in that situation. It's an unfortunate reality.
Yeah, the message I'm hearing from the legal community is this will come down to, they think, negligence. So knowing, kind of going out of your way to ignore decent practices and doing something that's putting other people in harm's way in a very overt kind of manner. So nobody thinks that there's going to be a ton of liability out there, but there will be some test cases.
Oh, yeah.
And it'll be, it'll be somebody going out of their way, knowingly going out with a positive test and putting themselves and others at risk that way.
Mm-hmm. Mm-hmm. And it's always just wise to be mindful, and it costs you nothing to have a conversation with your insurance agent. Right. So I would at least recommend doing that.
Yeah. There gets to be a point where it's, what else could I have done? And I think, as I look at Diane's business and the things that she's doing, literally, what else could she have done to prevent this? And the answer is any reasonable person would look and say, not that reason has a lot to do with the law, but I think you've taken every foreseeable precaution to prevent this. That doesn't mean it won't happen, but it does mean I've done everything I can to try and prevent it.
Exactly. So I'm curious, how do you think it's going to affect your businesses short term and longer term? Others. I'm very interested in hearing this.
Anybody out there in the salon business? I would love to hear about, do you open with extended hours to kind of get through the backlog? Do you, I think your throughput is obviously going to be affected based on having to, sanitize between customers, and how many, is the spacing adequate in your salons? Will you be able to use every chair you have, or will you have to use every other chair? Any thoughts around that in the salon or barber business?
And also, out of curiosity, as I read those guidelines over, there's some reference to and some suggestions that you may want to have specific hours or times of day for people that you think are perhaps a higher risk population. So, if you've got a group of elderly clientele who come in to get their hair done or get their nails done, do you do them on Tuesdays from 8 a.m. to 10 and only that time? I mean,
do you have a COVID fee for the sanitation and the time that you're losing within the business? So do you have that add-on fee for a period of time?
An extra question. Anybody out there? You guys ought to tell me what y'all do. So I'm going to throw this out. What have you learned from this pandemic about your business, about doing business in this environment? I mean, we'd love to be able to share some of that. Any thoughts? Is it happy hour? Is everybody gone? Well, I'll tell you one of the things I've learned from listening to so many different businesses in the last 6 weeks, and having conversations with them about things they've learned, is that thinking outside the box became the way for them to make it through this time. That reaching out to some of their colleagues has been very helpful. And I know I'm sure many of you are on Facebook or some other social media platform, but as I watch some of the folks that I know are my service providers, and so I'm Facebook buddies with them, and I'm watching these groups form where they're talking to one another and doing fun things to keep each other's morales up, to keep each other going through this time. Not that that's going to affect their ability to make money during a time when their business is closed, but it's just as important to take care of your mental health, your spiritual health, as we're all struggling through a very difficult time. What have you guys learned?
Vicki, I can tell you that I spend too much time on social media and online, but one of the things that I've heard in a lot of discussions is people who did not have a strong digital presence before this, or didn't think it was important, they sure think it's important now. So I've talked to people who, barely had a Facebook page and are now, you can order online and they just pivoted in a way that I think was really unexpected for them. They didn't think they would ever really need to do that. And I don't think they'll ever go back to, I don't see them thinking that this is a temporary thing, them being online. I think they'll going forward, they'll use digital media and social media and websites in a way that they haven't before. And they've learned that it's just something you need to do now if you're in business.
Yeah, I think one of the things I've seen is businesses that, because it's very easy to say, well, that's great, but I'm a hair salon, I can't have anybody in. But I have seen hair salons and cleaners and other folks really become a resource of knowledge. Say, okay, we're professionals in disinfecting. Let me give you some tips in the home that will help you disinfect during this time. And it sets you up as an expert and can engender customer loyalty down the road. I've seen salons say, listen, you're coloring your hair at home. Let me give you some tips on how to do that best to make it through that. We're excited to have you back, and we're looking forward to the day we can open our doors to you. But in the meantime, let me help you through this process. So even though we can't be together, let me impart some information and some tips that will get you through this time. And again, I think it helps build the brand and helps build that customer loyalty. I stole this from a client of mine that says, I don't know how to plan for failure. So I'm going to use this time to help plan for the time when we get through this and things start coming back.
Well, I actually made a suggestion to my hairdresser that she should do some online classes of how to style your hair to cover your roots.
Yep.
And I bet people would pay.
No doubt.
Help me with that. Or, from the cleaning service side, 3 easy steps to clean your bathroom or something like that. I mean, just
right.
Some sort of a presence that keeps you front and center in front of your clients, may expose you to some new customer opportunities and is in line with what you do. That you can use a digital platform for. Just some thoughts. Kevin, any
Yes,
questions
ma'am.
you want to throw out to the group?
Boy, I would be interested to hear of folks that have either pivoted their product or have given thought to, as I think about Chris's business, how can some of that be? Has he done anything on a virtual where he's helped, outfit a band so they can all be, in 4 different spots but playing together, or having the entertainment for so people that have pivoted their businesses in some way, shape, or form. I think Diane had a great thought around the safety aspect to doing what she's doing, but has anybody else reached out and become digital quickly or pivoted their business in some other way? I'll give you a great example in the restaurant. We have a restaurant, I live in Lake Mills. We have a restaurant here that rather than just opening up their menu, and I've used this story, Vicky's probably sick of hearing it, but rather than just opening up their menu, basically it's a chef special, and they do 60 meals, and it's on Facebook, and they say, here's what we're making today. It's chicken shawarma, or it's pork spätzle, and these are the side dishes that go along with it, and these are the desserts we have. And they limit it to 60 meals. You have to order by 2, and many is the time that by noon or 1 o'clock they're sold out. Very predictable for them. They know exactly what they need for help, and they give you a time slot that it'll be ready, and you pick it up to go and take it home. Again, I think it makes it, in a time where your revenues are going to be kind of depressed anyway, it keeps you from having over ordering or having food waste and trying to satisfy everybody's piece. And quite frankly, the meals are wonderful. They're a little higher end, and they're things that you would not normally think about going out and ordering. So it becomes kind of the guess what's in the box kind of experience every day.
Very cool. I'm curious, do any of you belong to trade associations that have given you any guidance for how you should reopen? or things that you should have been doing while you were closed. I know for a fact, Rochelle, that in the banking industry, there was a ton of guidance out there.
Yep. Yeah. Some good, some not so good.
Not so good.
Yeah.
Yeah, I just unmuted myself. So we're actually opening, obviously, you know, we've been open our drive-throughs, and by appointment, we are opening our lobbies tomorrow at all of our locations. So yeah, there's been a lot of activity as far as you know, removing furniture, using just like single card table type chairs. We have the, I don't know, better word than sneeze guards, I'm sure, but up in front of our tellers, crosses on the floor. You know, customer will be wearing masks when talking with customers. Obviously, we're not requiring them, but you know, strongly suggesting them. But yeah, back to your associations. Yeah, the WBA. I mean. ICBA, which is Independent Community Bankers of America. There is just a lot there, and that's been really great. We have a strong support group. I mean, we can just, to peers, you know, what are you guys doing? Things like that. So we're quite excited. A few customers that have been able to come in, you know, like for help with the PPP loans, you know, that prefer to come in and just to see them. It's pretty cool. Even though we've all, you know, been coming to work every day, we definitely miss our customers. So it'll be interesting.
A whole new world. Well, has anyone else got anything to throw out here? Because we don't need to take up all this time. We just wanted to make sure that we created an opportunity for people to learn from one another and to share. So, did anything come in on chats? Nothing I've seen.
Nope, nothing I've seen.
All right, well, it must be happy hour. That's a professional service
Yeah.
in my world.
I'm curious to sit in on tomorrow's too, with the
Thursday.
restaurants and the bars.
Thursday. Yep.
Yeah, Thursday is the bars and the restaurants and the cafes, yeah. Tomorrow will be a happy hour, but Thursday we'll do.
Yeah. The old adage from Southwest doesn't apply anymore. We can't be free to move about the country. So
No, no, we cannot be free to move about the country. Well, for all of you on the call, if you do have any other questions, thoughts, thriveed.org is the website. I'm very easy to find. I'm the president of Thrive ED, so it's just Victoria P at thriveed.org. And I think half the county's got my cell phone number, so it's not hard to find me. Feel free to reach out with any questions or thoughts that you may have. And between myself and Kevin and Gail, we might know the answers to all things in life, or not.
we know the people that do know the answers.
Oh, we need to know.
Yeah.
Well, I thank you all for getting on the call. Be safe, be healthy, get back to business. Let's make some money. And call us if you need us.
Yeah. Thank you all.
Thanks, everyone.
Diane and Chris and everybody that participated. Thank you so much for being here.
Really
Thank
appreciate
you for
it.
doing this. Really appreciate it.
You bet. Call us if we can help. Take care, all.
Take care.
Bye-bye.
Bye-bye.
Thank you.